Okay, so this is a joint work with Rafael Brusi from INSPER here in Brazil, Alexandra Cavias in Barcelona, and Mario, which is a student of ours in the University of São Paulo. The paper is called Under Pressure, Women's Leadership During the COVID-19 Crisis. Can you hear me fine? I didn't understand. Okay, good. So the motivation of this paper is that we know from the literature that political leadership plays a crucial role in shaping both social and economic outcomes. And we saw during this pandemic that the response of leaders around the globe in dealing with this crisis varied remarkably. So an evidence of that is that international press dedicated plenty of space in their pages to the fact that countries led by women, they performed much better than those led by men. So here we have some news about that. So the New York Times saying, why are women-led nations doing better with COVID-19? The Guardian saying a similar thing. Are female leaders more successful at managing the coronavirus crisis? And Forbes saying, why do women make such good leaders during the COVID-19? So while we know that female leadership is important in improving social and economic outcomes during, let's say, regular times, we don't know much about the role that women play as policymakers during global crises such as the one brought by COVID-19. We have some studies that documented that female leadership countries led by female presidents or leaders performing better than those by men, but we also have some papers showing the opposite or showing conclusive results. But basically, the other papers, the existing literature is basically correlation of studies. So what we do in this paper is we provide causal evidence that female mayors in Brazil, they performed better than male mayors in dealing with the COVID-19 crisis. We're going to argue here that we have the ideal setting to study this question for two main reasons. The first, because Brazil lacked a central response to the pandemic, and because of that, it was severely hit by the pandemic, especially in the first wave. Actually, the second wave was also very, very bad here, but we're going to focus on the first wave because it's the last year of the mayors were in office. And the second reason is that municipalities in Brazil, they enjoy autonomy to adopt policies. And I'm going to argue that in this particular context, this is even more relevant. I'm going to argue that in a couple of slides. Okay. So what we're going to do basically here is we're going to answer the following questions. First, we're going to answer the municipalities that were led by women, they had fewer deaths and hospitalizations due to COVID-19 in 2020. And in short, we're going to find that, yes, they did. And I'm going to present the figures here. Then we're going to ask, did female leaders respond differently to the crisis? Did they adopt different measures? Did they spend more? And we're going to see that they respond differently, but did they not spend more? For two reasons. Basically, they could not anticipate a crisis. And second, they do not have leverage to spend more, like especially in the short term. So what they do is they adopt more non-pharmacological interventions. And this answers the third question, which are the policies that they adopt and municipalities led by men did not. So mainly they adopted more use of facial masks and prohibition of public gatherings, and they made more barriers in the municipalities. So this is mainly what they did. What we also find is that the effect is stronger in municipalities with strong support for President Bolsonaro, and this communicates with the literature especially with the paper by Lucas and Jessica here, that shows how the speech of popular leaders can affect the behavior of people during the pandemic. And we show that the leadership of women is especially important in such circumstances, okay? How we're gonna do that? We're gonna use a regressions continuity design, focusing on mixed gender races. So we're gonna focus on races where a male ran against a female and won by and lost by a small margin, and compare situations in which a female mayor won by a small margin against a male. And we're going to complement this analysis using dynamic difference and difference approach, comparing both hospitalizations and death by what we call SMCCRARY, which is severe acute respiratory infection, in municipalities with male and female mayors, but relatively to the figures before the COVID-19 outbreak. So it's a standard between this. We have two differences here: male, female to male, and before and after the outbreak of the pandemic. This is interesting because this allows us to test the pre-trained assumption, and we show that the figures of SMCCRARY, of severe acute respiratory infection, they are similar before the outbreak of the pandemic, which is important for our inference here. So where are we in the literature here? First, we add here to an extensive research that investigates the role of women as policymakers. So we have a lot of work here, previous work documenting how female leadership increases social and economic outcomes, decrease corruption, improve policies, and etc. And our contribution here is to show that women are more efficient leaders in dealing with a global policy issue, a global crisis. And this, to the best of our knowledge, is the first work that addresses these questions. It also contributes to the literature that studies the role of female leadership during the pandemic. So I mentioned that there are some studies here and that the evidence is mixed. But overall, the studies here are more correlational. So what we do here is that we contribute by estimating the impact of female leadership using within country data. So to the best of our knowledge, this is the first paper that uses within country data. And as we believe it is the first paper that provide credible causal evidence on the role of female leadership during the pandemic. And finally, we contribute to the literature that investigate the role of popular leaders during the pandemic. And here we have Nicola's paper and Lucas, Jessica, and Paula's paper that shows that how attitudes of President Bolsonaro affected how citizens dealt with the pandemic, and we contribute to that literature as well in our heterogeneous exercises. Okay, so I'm gonna move now. Just drinking some water. The weather is pretty dry here in São Paulo. So just moving to the background part. This is important because it kind of motivates the relevance of the paper, because we have a very ideal setting. So you might know that in 2018, Brazil elected Bolsonaro as president. You might know that Bolsonaro is a far-right politician. And during the outbreak, his presidency was marked by, let's say, the reckless way he dealt with the pandemic. So the Brazilian government refused to follow international recommendations, did not adopt non-pharmacological interventions, and declined to establish any kind of social measuring distances and to promote any kind of measure in this way. So in response to that, Brazil became one of the hotspots of the pandemic, right? And you can see that one thing that illustrates that is that in the beginning of the year, Brazil had more than 200,000 deaths by COVID-19. We are now reaching 600,000 deaths by COVID-19. By January 2021, this was like 10% of the global deaths, and Brazil has less than 3% of the worldwide population. I could bring some updated figures here, but since we are focusing on 2020, because we had mayoral elections in the end of 2020 and the mayors changed in 2021, it's not much relevant for the paper for us to see some updated figures here, but I bet the figures are even worse if we look now. I bet Brazil has more than 20% of global death by now. So as a response to that, the Brazilian Supreme Court decided that federal government cannot unilaterally dismiss decisions adopted both by state governors and by municipal mayors to fight the pandemic. This is interesting for us because it creates a setting in which local governments have not only legal autonomy, but also policy instruments to influence the spread of the disease. So municipalities could adopt NPIs and could adopt measures to influence the spread of the disease. So at the end of the day, the absence of a federal coordinated response is what is giving us a variation here in order to study this issue. In developed countries, probably you would not see that because, I mean, in countries that have a central response, like New Zealand, for instance, you would not see different policies being adopted in different municipalities because the central government adopted a strong policy to fight the pandemic. So moving to the data, so we have basically three sets of data here. First, we have epidemiological outcomes, and they came from the system CISEP-GRIP, which is the system at Brazilian Ministry of Health, and we combine that with information from the census to compute number of deaths and hospitalizations per 100,000 inhabitants, which is the standard measure in the epidemiology literature, right? We also have policy outcomes, and to construct our policy outcomes, we use data from three different sources. So we use data from Timbra, which is basically Brazil's national treasury data set. We use data from the Ministry of Health to compute hospital beds. And we also use this data, which came from this paper from the Santos and co-authors, which documents non-pharmacological interventions that were enforced in each municipality. So basically what they did is a partnership with Brazil National Confederation of Municipalities. And between May and July 2020, they had 72, almost 73% of the mayors surveyed via phone calls and answering about adoption of non-pharmacological interventions. So basically, we also have baseline characteristics. So we have municipal covariates from the census, from what we call MUNIC, which is a survey also with mayors and local administrators about infrastructure and other things like that at the municipality level, and from the Ministry of Health to compute other stuff like number of hospital beds, etc. And we have mayor characteristics from the Brazil's electoral curve, and obviously we have our running variables, which are vote shares of the candidates, which are not here in the slides, but obviously we use them. So the empirical strategy, we are basically the issue here is well known by everyone here, but if we were simply comparing municipalities with mayors, male and female mayors, we would be incurring in the geneity issue, since the outcomes might be correlated with variables that can also influence mayor's gender, right? Since demographic characteristics at the municipality level, political preferences, and in general, any kind of variable that affects attitudes towards women, right? So what we do is we're going to rely on a short regression continuity design with the following specification here. And here, female vote margin is a margin of victory of the female mayor candidate. Female mayor IT is an indicator that takes value 1 if female vote margin is greater than 0. We also have here statistics effect, and why we do that, since COVID figures are reported by states, so actually they are reported by municipalities, but they are centralized in each state, and then the state authority is responsible for computing that. So by doing that, we correct some possible error that we have here, and we have more precise estimates by doing that. And we're going to do non-parametrically estimation following the standard in literature, what is canonical and co-authors. And our sample here will be municipalities where electoral rates had first and second place with different gender in 2016. And we're going to focus on municipalities with single ballot mayor races. This is because we have some municipalities in Brazil that have runoffs and some that do not. So we're going to focus on municipalities with single ballot mayoral races. Okay. In order for us to interpret our beta here as the casual effect of having a female mayor, we must satisfy 2 conditions here. First, the treatment must not affect baseline covariates, and I'm going to show you this is the case. But second, there might not be manipulation in the random variable around the cutoff, right? So we need to check that. And this second condition, what we're going to do here is we're going to look at this graph here, and we see that there is no bunching near the threshold. So here's what we do is we do a standard observable test, and we have a p-value of 0.30. And with that, we do not have any evidence of manipulation of the running variables. Okay. Then we move to what I call the first condition. And the first condition is that our treatment cannot affect baseline covariates, right? This is equivalent to saying that our sample must be balanced for both treated and untreated municipalities. I mean, municipalities with female and with male mayors, and a bunch of predetermined municipality characteristics, right? And this is what we show here in this figure. So here we have the colors are just to show how we group these variables. So we have in blue here we have hospitalizations and health outcomes in general. And in green we have social characteristics, and in yellow we have political characteristics. So what we show here is we show both statistics to show if the difference is significant. And we show a standardized beta here for us to see if the economic magnitude of the coefficient is significant, right? And we see here that all these variables are balanced around the threshold, so we do not have any evidence of imbalance in these variables. I'm going to show you that there's some imbalance in mayor's characteristics, but we're going to discuss that later. Okay. So I'm going to move now to our results. I'm not going to put here the local difference in different in the estimation part, because it is just a complementary analysis. So I'm going to show you that I'm going to talk about the empirical setting just before I talk about the results, but it's a pretty standard local difference in difference approach. So talking about the results, what we're going to have here is that just to sum up, and then we're going to show you the tables, but we're going to see that municipalities that are like the women, they experience 25.52 fewer deaths per 100,000 inhabitants, and almost 47 fewer hospitalizations per 100,000 inhabitants. We find that what can explain this is the number of NPIs, so number of non-pharmacological interventions enforced in municipalities led by women, especially mask usage and prohibitions of gathering. We do not see any pre-outbreak change in health expenditure or in health infrastructure, here measured by ICOS, and we do not see any change in health expenditure post-outbreak, and the same is true for health, for change in health infrastructure. Okay, so this is basically our main result. So here in panel A, we have the results using a linear specification. We show the result that I told you, minus 25.52 or 53 COVID-19 deaths per 100,000 inhabitants, minus 46.96, so almost minus 47 deaths per 100,000 inhabitants. And we show here in column 3 and 4 the results using SMCCRARY. So why do we do that? We do that because SMCCRARY is much less subjected to measurement error, right? So I apologize for the dog. They probably hungry. So we show that the results for SMCCRARY, they are much more they are much similar to the ones with COVID. So this is pretty much telling us that measurement error is not an issue here, since the results are similar. In panel B, we show the results using quadratic specification. The results are pretty much robust. The magnitude changed a bit, but not much. So the results are robust using quadratic specification. Okay. Here we have the RD plots. So for COVID deaths, SMCCRARY deaths, then COVID hospitalizations and SMCCRARY hospitalizations. Okay. Then we move to the local. I'm going to talk about the heterogeneous exercises and potential mechanisms. But before doing that, I'm going to show you the local difference in different exercises. So what we do here is we try to provide some additional evidence estimating a local dynamic difference in difference using quadrilateral. So we're going to compare SMCCRARY outcomes in municipalities with mayor with municipalities with female mayors relatively to the figures in the first quarter of 2020, which was just before the outbreak of the pandemic. So we're going to estimate this equation. Y is the outcome, which can be either death or hospitalization in municipality M and state S in the quarter T. Okay, and we're going to estimate that for every quarter except for the first quarter of 2020, which is our reference here. We're going to control here for a polynomial at the municipality level, basically to mirror our RD specification. So basically here what we are doing is we're going to, it's almost as if we were estimating an RD in each quarter. We could actually have done that. It would be a very similar exercise, but we are doing a local bid, but it would be basically the same exercise. And then we have here a bunch of fixed effects. So we have municipality, state fixed effects. We have state and time fixed effects, and then the error. Okay. Our sample here will be composed of municipalities that are near the discontinuity. How near? Well, we're going to use the optimal bandwidth obtained in our RD estimators, again, to mirror our main specification, okay? And these are the results. I'm not sure if you can see that, but we have here salary deaths on the left and salary hospitalizations in the right, and then here using linear, right? In the top panels, we are using linear polynomial. In the bottom, we're using quadratic. But basically, what you see is that before the first, if we compare salary outcomes before the outbreak, basically the difference between municipalities led by women and men is 0, right? So we do not have any difference. And after the start of the pandemic, we see that these changes begin to appear, and they become significant in the last 2 quarters. Okay, so this is basically just complement the analysis, but it's just saying the same message, right? That municipalities led by women, they are doing better during the pandemic. For Jessica, and look at the knows well Alex, you might know that this is Alex's stuff. Alex loves to do like double diff and triple diff stuff. So this was his idea to complement the analysis, and I think it was very nice. It was very convincing. Then we move to the part of the where we check which policies might be explaining this. So in panel A, we are looking at health investment, and what we do is first we look at the first 3 columns. The change in health spending and number of hospital beds and number of ICU beds between the beginning of 2017 and the end of 2019, which is basically the first 3 years of the mayoral term. So we do not see any evidence that female women are investing more in health overall, right? Before the pandemic. So this is basically, we are just replicating the result that Fernanda Brolo had in her paper. She doesn't find any difference in health spending. And basically what we are doing here is the same. And what we do in columns 4 to 6, what we do is we replicate this exercise by looking only for the year 2020. That is after the outbreak. So we use as baseline, as the start of the period, the number of the health spending or number of hospital beds or ICU beds in the beginning of 2020, and then the end line is the end of 2020. So we are looking at the variation here within the year 2020 to see if mayors, female mayors, they invested more in healthcare after the outbreak of the pandemic or during the pandemic. And again, we do not see any evidence of that. In panel B, we're looking at non-pharmacological interventions, and we see that on average, women adopted 0.37 more non-pharmacological interventions. This is a number that can go from 0 to 5, because we have in the survey we have 5 NPIs. So basically, it can range from 0 to 5, and women on average they are adopting 0.37 more NPIs. And which are these NPIs? Basically, space covering requirement, gathering prohibition, and barriers in the municipality for people not entering and living the municipality, but it's a bit more noisy, but it's significant at the 10% level. These are the NPI plots, D plots, and those are interesting because you can see that the number of NPI, there's a 3-year discontinuity here, face covering requirement as well. But if you look at gathering prohibitions, what's going on here is something very, all women in the survey required, all women in the survey, they did something that forbid gathering of people, right? But some men here did not, and this is generating this discontinuity, right? So we do the same here for barriers in the municipality, and then closure of non-essential business and public transportation restriction. And for these last two, we do not have any significant results. Okay. Finally, we move to investigate what is generating these results. In the literature, there is some discussion that if we should investigate if there's a balance between characteristics of female and male mayors. And what we do here is we check if everything is balanced at the mayor level. So we're basically looking at if mayors' characteristics are balanced between male and female mayors, and we're going to look at age, education, party ideology, and all those things. Basically, what we're going to do is we're going to test a few male mayors that win against a mayor. They're different in this observational structure. Okay. So what we see here, and this is this basically was documented in other papers. We see that women that won by a small margin against men, they are more well educated, and they also, which is interesting in the setting for Brazil, we see that in the ideology rule, they are a bit more to the right than their male counterparts. So what we do is we re-estimate all our equations again, controlling for that. And we find that our results are robust to that. So basically here, I'm just showing you that the results on number of NPIs is robust to that. We find 0.37 again. And this first three NPIs, they survive controlling for that. As a final step, what we do here is we're going to investigate which municipalities, in which municipalities the result was stronger. So as I told you, Brazil is led by a president. I'm going to say led, but it's still led by a president who dismissed the pandemic, and so for mayors it was very challenging to deal with the pandemic, right? So basically, mayors here they face a trade-off, because in municipalities where the president faces strong support, APIs might be more important, because the paper by Lucas and Jessica shows, in these municipalities, people respond more to president's attitudes and tend to take behaviors that can be harmful in the setting of the spread of the pandemic, right? So in these municipalities, the enforcement of policies might be even more important than in other municipalities, right? On the other hand, it's much more costly for the mayor to adopt NPIs in these municipalities. And why is that? This is simply because the population supports more President Bolsonaro and then support more his attitudes, right? So which one of these two is going to prevail is an empirical question. And this is what we do, is that in which municipalities female mayors are more important. And then we find that what we do here is basically we split the sample in above median, and President Bolsonaro is both shown in the first round, and below median. And then we find that basically our result comes from municipalities above median. So if we take municipalities, how should we interpret that? We should, if we take municipalities where President Bolsonaro has a strong support, we're basically saying that having a female leader in these municipalities makes a huge difference. If you take municipalities where President Bolsonaro do not have a strong support, then having a female against a male mayor does not make a huge difference. Okay, so this is how we should interpret this result. Okay, so just to sum up here, to conclude, what we show here is that election of female mayors caused a large and negative effect in the decrease of number of deaths and hospitalizations in COVID-19 pandemic in the first phase of the pandemic. A plausible mechanism here that is explaining our results is the enforcement of NPRs. We do not find evidence that female mayors are spending more or creating more ICU beds or anything like that. They're just adopting more non-pharmacological interventions. We find that this effect is stronger in municipalities where the president has a strong support. And we have some questions here for future research. The main two questions we have here is did these female leaders also perform better during the vaccination? This is something that could be looked in future research, right? Or did they perform better in promoting economic recovery after the pandemic? So this is also something that could be looked into. Also, another question here is how this result that we're finding here in the public sector, how do they translate in the private sector? If we look at companies that are led by women, did they perform better during the pandemic than those led by men? So basically, this is the main results that we have here. I'm open for questions if you have some.